Hi, welcome to the Commissioner's Report. I'm your host, Jeff Foley, and I'm joined today by District 5 Commissioner Neil Combee and special guest Don Van Stee, who is the Administrative Services Director of TriCounty Human Services. Hello, gentlemen. How's it going today?
Good. Fine, thank you.
Thank you for taking the time to be here. We appreciate it. So we're going to talk a little bit today about TriCounty Human Services. Don, would you mind starting us off by just talking a little bit about what TriCounty does for Polk County?
Sure. TriCounty Human Services, we were founded in 1974 by a group of concerned grandparents who had an alcoholic grandson at the time and used to park their station wagon and give out leaflets at the corner of Clubhouse Road and 98. We grew from that, obviously, and in 1976 we became a not-for-profit and also a 501c3 designated organization. We have the employee that has number 1 on her employee record still works for us, and she'll be retiring very soon, but she's been with us since 1976, and we enjoy having her here. Currently, TriCounty Human Services is accredited by the Commission on Rehabilitation Services, which is called CARF, and we've been approved by CARF since 1999, accredited. We rank in the top 2% of all behavioral health organizations in the United States with regards to compliance to CARF and the things that we do. We have, in Polk County, we have four outpatient locations. We have 5 residential locations plus the administrative offices in Polk County. Our locations are basically in Bartow, Winter Haven, and in Lakeland and the county proper. So we have a pretty large imprint with regards to the kind of services that we offer here in Polk County. We have also an additional program we call Meadowbrook Psychiatric and Counseling Center. It is basically primarily for mental health, but we have 2 psychiatrists, 6 mid-levels we call physician assistants or APRNs. We have 3 medical assistants as well as 3 licensed mental health counselors. So if in Meadowbrook, if the psychiatrist or the provider thinks that they would be benefiting better for clinical treatment versus medical treatment, they can refer over to that counselor for therapy and or group sessions or whatever. And that's been enforced for the last 5 years now. We've also have grown from the standpoint that not only do we do outpatient programs and we do residential programs, but we do things linked to the community. We do in-home services that we can go to individuals' homes and provide services for them. So if somebody can't get to our facility, we can always go out there and see them. And we also have special programs with Polk County that anybody that's being released from the jail that has behavioral health issues, we have a program called Helping Hands that links with them before they get out of the jail. And so once they do get out, they will link in with the paramedics to get them to scheduled services, whether it's psychiatric services or substance abuse services, and we help them link to safe housing as well. Because we found that individuals that are involved in safe and secure housing, their treatment outcomes raise exponentially more than what they would be expected if they didn't have that. So we've become very diverse. We have one of the greatest and most intensive systems of care that any agency in the state of Florida offers. If somebody comes into our detox, and I'm talking specifically about a female, but if she comes into our office, into our detox, she can be referred to one of several residential programs and be in that residential program for a period of time for 6 to 8 months. And then once they graduate from that, they can go to a halfway house and stay there for 6 to 8 months. And during that time, they're learning skills such as budgeting, financial planning, aggression control, and how to work with their kids. And they also start their planning to get reunified with their kids. Once they graduate from the halfway house, they go to what we call transitional living. And at that place, they can be either going through vocational training or some other kinds of training, or get a job and get reunited with their children from the Department of Children and Families. And they can be in that program for several years before they can graduate from there. And then once they graduate from transitional living, we'll hook them up with housing vouchers so they can move into a supportive housing that would be appropriate for them and for their children and become productive members of the Polk County Society. And That doesn't happen in a lot of counties. A specific agency could specialize in outpatient therapy, but they don't do anything in residential, and so they have to refer to somebody else. But with TriCounty, they stay in that same system of care, different counselors, but the same records are maintained, and we keep track of them through the whole system for the period of time that they're there. So, and we've been recognized nationally for that, and we feel very good about what we can offer to the people here in Polk County.
Now, Commissioner, I know this is important to you. Can you talk a little bit about why it's important to you, and maybe about how American Rescue Plan dollars help?
I don't really remember how much we received in ARP funds in total, but there was about $12 million that was undesignated, and the board decided that we would take and divide that money 5 ways, and we could look at providers in the community, all kinds of different providers that could benefit from those dollars and provide services to our community. Well, my focus was on mental health and substance abuse. I thought, I really need to make sure that we've got that covered. We do a great job in the county, and we had a meeting about it today. And when you look at the numbers that we put into mental health and substance abuse, it's significant. And in fact, it's a lot bigger than most parts of the state. But I think it's something we need to do. With COVID, a lot of people, I was hearing, we were all hearing about the mental anguish that was taking place with folks locked down and out of a job, and their businesses collapsing because they can't open their doors. So it seemed like a really good idea to pour some money into that. And TriCounty is one of the oldest and longest providers in the county, so it seemed like a good choice to go with TriCounty. I did not know how it started. This is news to me, and interesting to hear that little story that Grandma and Grandpa got it started, but it's been around for about as long as I can remember. I can't remember much past '76, although I was in high school back then. But anyway, I knew they would do a good job with it. Peace River, another that received quite a bit of funding from us, but really just to work on those substance abuse issues, which create so much misery for individuals and for families. And I think that it was a good move on our part to pass the money over to TriCounty and expect that we get some good results from them.
Yeah, it's definitely being used in a very positive way. Don, how many people would you say are helped each year?
Well, we've had this contract since January of 2022, so we've had it now about almost 11 months. And what we do is we've hired a licensed counselor, and they provided training to our counselors on issues that related to the COVID, with fatigue, depression, anxiety, all those things, and how to recognize those symptoms. Not only because for our counselors, people are coming in and they be displaying those symptoms, and we wanted our counselors to pick up on that so they can work with them on the thing. But also what we do is we go out into the community. We're right now working with the American Red Cross, and we're teaching them how to recognize the symptomology, so if they see it, they can make the referrals over to us so that we can pick it up from there and help them during that time. COVID has been one of those things that has been, very, very, in the initial part, it affected most everybody, and we had the lockdowns, and we had the masks, we had everything else, and then it started declining, and then it did, like every other virus does, it mutates, and all of a sudden it started springing up again. And we had the Omicron virus, and we've had other kinds of variants that are out there. And the CDC is saying that right now, because we're going into wintertime, we might see some increases more in COVID, in the COVID virus that's out there and being detected. So that's why we're reaching out to the hospitals, we're reaching out to the American Red Cross and other community and civic organizations to have our counselors go out there and say, here's what we're seeing, the symptomology we're seeing from our patients. If you recognize that with the people you're serving, or if you recognize that with your employees, here's the kind of things that you can do, and then get them over to us so that we can get them involved in treatment and help address those things. TriCounty does a lot in the substance abuse area. We do a heck of a lot. We just talked about from Meadowbrook on the mental health side. And so with the availability of our licensed program people, with our medical people and our prescribers, we kind of offer the full plate of things that can help them. And as I said earlier, if the medication doesn't help them, or they feel that, if the prescriber feels that the medication would be a supplement but it's really therapy they need, we can provide for them right on the spot and as a warm handoff. So those are the kind of things that our trainer goes out to the community and to our in-house people about what it is that these funds will do for them and what it is that the people that are seeing these symptomologies being exhibited, to help get these people the help that they need.
So Don, we're running tight on time. We're about to wrap up. Can you just tell people how they can get involved, or if somebody wants more information or needs help, what's the route to do that?
Yes, if they would like to have more information, they can call us at TriCounty. The area code is 863-709-9392. Push 0 for the operator and tell them that you need to talk to somebody with on the COVID treatment area, and they'll refer them over to our counselor for that, and our director. Her name is Heather Kaufman, and Heather will direct them over to whoever they need to have that treatment. It doesn't make any difference if you're in Winter Haven, if you're in Dundee, if you're in Lakeland, Bartow. We have facilities in those areas that can help you, so you don't have to travel all over the county to get that help. It'll be in your neighborhood somewhere.
Perfect. Hey, I want to thank you for joining us on the Commissioner's Report. We'll see you next time on PGTV. Thank you for watching. Please make sure to subscribe and like our social media.